Reducing the burden of cancer. That's the vision of the Canadian Partnership Against Cancer. While significant progress has been made, cancer remains the leading cause of death in Canada. Erika Nicholson is the Vice President of Cancer Control with the Canadian Partnership Against Cancer. She joins us to share how the Canadian Strategy for Cancer Control is working to achieve its goals across the cancer continuum, from prevention and screening and diagnosis to survivorship and end-of-life care. Erika, thanks so much for joining us today.
Thanks so much for having me.
Please tell us about the Canadian Partnership and its vision for a pan-Canadian strategy. What is it that you do, and what is the organization's mandate?
So, the Canadian Partnership Against Cancer was established more than 15 years ago to serve as stewards for Canada's strategy for cancer control. And our mandate is to work with partners from all across the country, as well as international partners. So that can be cancer programs, clinicians, people affected by cancer, community groups, to really drive progress towards the goals and the changes that people in Canada have said that they want to see in our cancer system. Ultimately, the goal that we're all working towards is to reduce the burden of cancer on everyone in Canada.
Well, as a steward for the Canadian Strategy on Cancer Control, what are those key priorities that you're working on?
So, the strategy has 8 key priorities that are supported by some calls to action, as well as key enablers that will catalyze and support the changes we want to see. Importantly, 3 of those priorities were identified by First Nations, Inuit, and Métis. And the other priorities span the cancer control continuum. So there are priorities around prevention. There are priorities to help us find cancer early where there are better chances of treatment and cure, making sure that the quality care systems are there. We're supporting the growing population of cancer survivors and supporting patients with palliative care and end-of-life care needs. As well, there's a lot of supports required from information and other access issues. Ultimately, throughout all of this strategy, there's a common thread that over the next 10 years, we want to work together to make sure that everybody in Canada benefits from this strategy. So equity will be at the heart of all the work that we do. Importantly today, I would like to share that one of the priorities of the strategy is to diagnose cancer faster, accurately, and in early stage. In doing so, we have a tremendous ability to really change outcomes for people in Canada. And one of the tools that we have to do this is to strengthen screening programs for cancer across the country.
Well, and often there's confusion. What exactly is screening, and how does that compare perhaps to sort of diagnosis?
Yeah, thank you so much for that question. So, screening is, I call it a wellness. It's a healthy behavior. It's something that you do if you meet certain eligibility criteria. Often you reach a certain age, and you do a test regularly, every 2 to 3 years. Particularly, it's important to be screened regularly if you're feeling fine, if you don't have any worrisome symptoms. Early diagnosis, by contrast, is something, for example, if you're just not feeling well or something doesn't quite feel right, you have some symptoms. And then that's not really screening. That's you go to a healthcare provider and they'll provide different tests sometimes to make sure that they find out what's causing those symptoms. If I come back to screening, the whole principle there for screening is that we can't screen for every cancer, but some cancers like breast, cervical, colorectal, and now we're understanding with lung, they develop over years, sometimes decades. And so it also takes a long time for people to feel symptoms. So if you apply that test every year, every 2 years, every 3 years, we can catch that cancer really at an early stage before a person even knows and really can change the outcomes for the better for those people.
Early detection indeed provides the best protection. Well, breast and cervical screening were the front runners in terms of population-based screening in the late 80s and 90s. What advances have been made in cancer screening programs in recent years? And how is that addressing some of the barriers to screening?
As you've indicated, we've got a great history of quality screening in Canada. Breast and cervical screening, yes, they've been around for decades now. The newer screening, and I'm pleased to say, the advancements have included the introduction of screening programs for colorectal cancer. And so we're seeing the expansion of of screening programs across the country. And now we're in an exciting phase where there's really good evidence to support lung cancer screening for a subset of individuals at high risk. And so programs are starting to be developed, and I'm hopeful that over the next 5 to 10 years, screening programs for lung cancer will be available over the country, all across the country. We do know, though, that not everybody experiences cancer, not everybody experiences screening in quite the same way. And it's often a matter of equity. Where you live, your income, how long you've lived in Canada, the language you speak at home can really make a big impact on whether you participate in cancer screening or not. So we know, for example, working with our partners across the country, that if you live on low income, you're less likely to be screened for colorectal cancer than someone who's living on higher income. Equally, as we work across the country to plan for the implementation of lung cancer screening programs, we see that people, lung cancer itself is not a disease that impacts everyone equally. Equally, if you live on low income or if you're living in a rural or remote region and you develop lung cancer, you're more likely to have that cancer diagnosed at a later or more advanced stage than someone who's living in an urban setting. We also know that different people have different supports that are required, right? And so we're working with partners. There is amazing activity that's happening, not only to understand the barriers to screening, but also to apply some of the strategies that have been proven to close those gaps. So how can screening programs work to facilitate access and contact with the healthcare provider? How do we get screening technology to people in a different way? So, for example, mailing a home screening kit for colorectal cancer opens up a lot of doors that improve access versus having to go to pick up that test, for example, at a clinic or at a pharmacy. And importantly, I talk about the information needs. Screening, not everybody understands screening, how it may fit into their priorities for their self and their health. And so what are the information needs that people have as they think about cancer screening? How do we support healthcare providers in having that information? And importantly, I will say that, collaborating with communities, particularly communities who are underscreened, to co-create culturally appropriate, culturally safe services, particularly amongst First Nations, Inuit, and Métis, recognizing the experience of systemic racism in healthcare, of intergenerational trauma, jurisdictional issues, a lack of access. All of these can be really significant factors that can either support or hinder participation in screening. So as we go forward in the next 5 years, I think putting equity right at the heart of the work is going to take on increased significance to overcome the barriers and to close those gaps, particularly as we work to recover from the pandemic.
Well, it's clear you're tackling those barriers head on. And on the topic of the pandemic, there's no question that it has impacted everything from business to medical care. What has the impact been on screening rates?
Yes, like business, medical care, it felt like the world stopped in the first wave of the pandemic, and screening was not exempt from that. And indeed, many programs did pause or reduce their services. The concern being that knowing the impact and the powerful potential of cancer screening to find cancer early, we want to make sure that those programs are robust and strong and weather other waves of the pandemic. So we've worked really hard with partners to make sure that cancer screening services remain resilient throughout the pandemic and beyond. The other impact, though, for me of the pandemic beyond service levels has been it has shone a light, it has ripped the cover off those social inequities, those systemic and structural barriers that prevent people from seeking healthcare and getting the quality care that they need. And so people were disproportionately impacted by COVID-19 are also, in many cases, those groups have been traditionally underserved by the healthcare system and screening programs. And so for me, I think if I can turn the negative into a positive, I think for me, the lasting impact of the pandemic will be galvanizing the cancer screening community in Canada to work together to take critical and important action to embed equity at the heart of all of new program development and all advances in cancer screening across the country. And we're already seeing amazing collaborative action in this space.
Well, you were talking about screening for colorectal cancer earlier, and it's been offered for some time. Tell us about some of the examples of colorectal cancer screening programs across the country and why you're encouraged by this work.
Sure, maybe I'll set the stage a bit. Colorectal cancer screening has been available across for the country for some time. Colorectal cancer is one of the leading causes of cancer death in Canada, and we have a screening test that has been shown to not only catch colorectal cancer early, but in some cases, it can catch early changes before they become cancers. So it can prevent colorectal cancer. And even with all that good news, we're not really reaching our national participation target of 60%. So I don't want to be doom and gloom because there is tremendous work that's happening. We know that there are certain populations, for example, people who are on low income, people who are newcomers to Canada, where we really need to focus to increase and support screening participation in those groups. We're doing some really great work with partners at the community level to work and understand not only the barriers to cancer screening, but to co-create solutions to support colorectal cancer screening. We want to drive that participation. We want to not only hit that 60% target, but exceed it. So I'll share some examples of the great work that's happening. Partners in Alberta, for example, are working with Calgary's Punjabi Community Health Services. They're recruiting participants for online surveys and focus groups to talk about what do they need to feel comfortable screening. And international medical graduate students in Alberta are providing real-time translation services and providing culturally appropriate information in these dialogues. Out on the East Coast, New Brunswick is working with the food banks to reach low-income people and food bank users to really, again, engage in dialogue, understand what do they understand about colorectal cancer screening, what would be supportive in cancer screening, and the findings from that work will inform New Brunswick's colorectal cancer screening work more broadly. And maybe I'll leave a third example. In the height of the pandemic, the Northwest Territories engaged in a very community-centered way, a community with the lowest screening rates in the territory. And during the course of the pandemic, they doubled participation in cancer screening. So amazing lessons learned that are going to benefit and be spread across that territory. So there's a lot of really exciting developments there.
And as you say, increasing those colorectal cancer screening rates to 60%, I was startled to read that would save upwards of 130 plus lives each and every year. That's a significant number of Canadians.
Absolutely.
Well, let's turn now to the work that's being done in the area of lung cancer, because that's relatively new. What excites you the most about what's going on with lung cancer screening?
There's a few things. First of all, lung cancer is a leading cause of cancer incidence and mortality in Canada. And so if we can stop that, if fewer people can die from lung cancer, quite frankly, we will be a long way ahead reducing the burden for people in Canada. The other piece is we have this new technology, as you mentioned, around lung cancer screening. And when we look at who is being diagnosed with lung cancer right now, we see not everybody is being impacted in the same way. So for example, people with lower income are nearly twice as likely to be diagnosed with lung cancer than those at higher income. And interestingly, if you take two people, one lower income, one higher income, that were diagnosed with the same type of lung cancer at the same stage, the person on higher income will have significantly better outcomes than the person on lower income. If I go back to the Canadian Strategy for Cancer Control, there is that priority on diagnosing cancer early, accurately, and in a timely manner. And there's a specific call to implement organized screening programs, culturally safe screening programs for lung cancer screening. And so what I found tremendously inspiring, quite frankly, is the level of activity, the planning work that's happening across this country during the height of the pandemic to make lung cancer screening programs a reality. The other piece I want to focus is that this planning is happening, I think, in a way that is different from how I've experienced other planning. These programs are being co-created by the communities who stand to benefit the most. They're being co-created with, for example, First Nations, Inuit, or Métis partners who have said this is a priority for them, and with other underserved communities. And already we're seeing the fruits of that work. There are great relationships that are being established. And as programs are being planned, we're not expecting that they will roll out maybe in the urban academic environment, but they'll start in those northern, those rural, remote areas that the evidence tells us there's the greatest need. And quite frankly, they'll be the greatest benefit for people. So that, I think, over the next 5 to 10 years, I'm really excited to see how that landscape will change across the country.
So, Erika, the evidence is clear. Early detection is saving lives. So, the word of advice to people watching?
Absolutely. So, cancer screening may not be on the top of your priority list, but I'd like for you to put it there because cancer screening, when done, particularly when you're feeling well, you don't have signs or symptoms, that's the best time for you to be screened. This is one thing that you can do, those 5 to 10 minutes, to take care of your health and to stay well. So if you're eligible for that mammogram, if you're eligible for a pap test or an HPV test, if you've received your home screening kit for colorectal cancer and it's languishing around your house, take those 5 to 10 minutes. They could be life-changing for you in the best way possible.
Thank you so much, Erika. There is hope that we can look to a future in which fewer people will get cancer, fewer people will die of cancer, and certainly a better quality of life for those living with the disease. Erika Nicholson, we thank you for the great work that you do in this regard and for sharing details of the Canadian Partnership Against Cancer today.
Thank you so much. It's my pleasure to share this with you, and it's a privilege to work with amazing partners across the country to chart the progress that we're looking to see to indeed reduce the burden of cancer on people in Canada.